Okay, here is the exam two recap, most missed list. I will tell you that statistically speaking, exam two is the toughest exam in this class. And that played out today, as you know. It was pretty difficult, right? So I just want to say several people told me at the end of the exam they were disappointed in how they did, even if they had a perfectly good passing score. So I'll say again, and Brenda said this at orientation, and I think I said it's something like it in my um, intro to this class. You have to really bear in mind that in a professional technical program versus an academic program, we're talking pass, no pass. We're not talking, um, it doesn't matter whether you get an 89 or a 99, you passed. And those extra 10 points don't matter. It doesn't matter if you get a 79 or an 89, you still passed. Those extra points don't, those extra 10 percentage points don't matter. If you got below passing, that does matter. And it is a hard adjustment to make going from an academic program to a professional technical program, but I want you to try to make that adjustment. And I was talking to Ange, one of the instructors that you'll see in your second year for your orthopedics classes. She's a DPT and she went to the University of Washington. And she said when she was in her DPT program at the University of Washington, the a lot of the a lot of her people in her cohort who went to their undergrad at the University of Washington, I guess it's very dog eat dog and very cutthroat, and everything's graded on a curve. And they were very grade focused and very competitive. And it's not a competitive program. It's a cooperative program, and that's the same thing with our program. It's not a competitive program. You doing well doesn't change anybody else's how anybody else does. We want you all to do well. So helping each other and working with each other, and everybody does better if we all work together. And bear in mind that it's pass, no pass. Don't feel bad if you got an 80 on the exam. That's a pass. Feel good about that. Go out and celebrate. Go down to Cafe Akotere in Bellingham and get the flaming cheese where they light it on fire and you yell "Opa." So that is something to celebrate. You passed. Pass is a pass, and that's what's important. So it doesn't matter if you got a 79 or an 89 or a 99, you still passed. If you didn't pass, that's what you should be concerned about. So I'm going to leave that right there, and let's talk about the most missed list. So I'm going to throw out two questions, number 17 and number 36, and I will tell you why when we get to those questions. Let's just look. So 33% or more of the class missed this list of questions, and I'll go through them. Interestingly enough, a lot of the breakdown, it was 67% got it and 33% missed it. Interesting. And they were all different people missing it. So I don't know how those numbers came out like that, but they did. Question number 3, this is a muscle question. So I said a couple times in a couple different ways that not so many of the questions on the test are what's the origin and insertion of this muscle, but where is it and what's its function is kind of the more important thing. And this is a where is it and what's its function sort of thing. So if somebody's toeing out during stance, that's our observation. What muscles in toeing out is lateral rotation of the hips. And so if the hips are in a laterally rotated position, the muscles that are most likely to be associated with or be tight with that are the hip lateral rotators. So the ankle plantar flexors are not going to laterally rotate your hips, nor are the hip medial rotators. That would give you a toed in position. And the knee extensors are also not going to affect that transverse plane motion. Okay. So hopefully that makes sense. And if it doesn't, let me know. Question 8, this is a passive and active insufficiency question. So what words are we looking for in the passive and active insufficiency? Actively is the word that 44% of the people, I was quite honestly flabbergasted when I saw this. But so when the hip joint is actively flexed as far as it can go, and the knee is in a fully extended position, actively. So it's got to be either active insufficiency of the rectus femoris or active insufficiency of the hamstrings, not passive, because the word actively is in the question. 50 of the 56% of the people that missed it, most of them picked passive insufficiency of the hamstrings, despite the word actively in the question. So that's what flummoxed me on that. But so the guy in the upper part of this picture is showing the rectus femoris actively overshortened because he's actively doing that question or actively doing that motion, and it's active insufficiency of the rectus femoris. So it's not passive insufficiency of the hamstrings because the word actively is in the question. Question 15, this is another one of those, what motion is going to be limited due to tightness? So if it's a muscle that's limiting hip extension, it would have to be a hip flexor. So of those muscles, gluteus medius is a hip abductor. That's not going to limit hip extension. Semitendinosus is a hip extensor. That's not going to limit hip extension. Iliopsoas is a hip flexor. That's going to limit hip extension. And that was the correct answer that 67% of the class got. And gluteus maximus is also a hip extensor and lateral rotator, and it is not going to limit hip extension if it's tight. So we're looking for the hip flexor, and the iliopsoas is there to fill the bill. Okay, this is the first question that I'm throwing out, and I'll tell you why. It was an active and passive insufficiency question, and the word passively was in the question. So we know that it's passive insufficiency of one of those muscles. But I think the thing that confused most people was the position in supine. That's crazy, right? We didn't do that in lab. So that's why I'm throwing it out, because we didn't do it in lab. This was a little turning your brain around. We have to turn our brain around when people are in different positions. So this is the position, the picture that I have of this this guy. He's in supine. His hip joint is passively extended, so gravity is extending his hip passively, and the knee is flexed as far as it can flex, but it's limited by the fact that the rectus femoris is stretched over both joints. And so it's passive insufficiency of the rectus femoris. But only 39% of the class got that, so I am throwing it out, and I think it's the position that confused people. One piece of feedback that I got, and this I feel is a valuable piece of feedback, which I'm going to act on for the next test, is having a picture would have made all the difference, wouldn't it? If you had had this picture, I bet more people would have gotten it right, and I wouldn't be throwing out the question. So the NPTE, the National Board Exam, they are now doing a lot more videos and pictures in their exam. And so I'm going to follow suit, and I'm going to add more pictures to the next exam. So expect that down the road. If you think that you would have got this better if you'd seen that picture, I think you would have. And hopefully that makes sense. But I'm throwing it out. So if you got it right, yay, good for you. If you didn't get it right, you're not getting any points off. So yay, good for you. Okay, question 18. This is what's happening with the abductors, hip abductors during gait. Remember, they're controlling the pelvis in the frontal plane. So the first possible answer was the hip abductors control the pelvis in the transverse plane during the single leg stance phase of gait, and no, they control the pelvis in the frontal plane. So that's why that one's incorrect, wrong plane. Trendelenburg sign is caused by weak hip abductors on the open chain leg. That is not correct, because it's the closed chain leg. The correct answer is that the stance leg must hold the pelvis level, or else the contralateral side will drop. That's the correct answer, and that is Trendelenburg sign when that happens. The last incorrect one was weak hip abductor on the stance leg causes the ipsilateral pelvis to drop, and it's the contralateral pelvis. So hopefully that all makes sense. And 67% of the class chose the correct answer, and 33% missed it. That's our 67-33 split. So this one is basically a where is the muscle question. This is an insertion question, an origin question. And the patient who sustained the groin injury, the pain is focal to the anterior surface of the pelvis. So another way to ask is which one of these muscles inserts on the anterior surface of the pelvis. But it's an indirect clinical way of asking, which is the way they like to do it on board exams. 56% of the class got that it was the pectineus. Yay. 44% missed it. There were several people that put adductor longus, which does insert lower on the pubis, or more inferior on the pubis. So that was, a reasonable miss. The iliopsoas doesn't go anywhere near the pubis, nor does the semimembranosus. So there you go. So the question 21 was the kinematic strategy. You're sitting in a chair and you're bending over from your hips to reach your backpack, and it's a short arc pelvis on femur. And the reason it's short arc is because you're already flexed to about 90 degrees in your hips. So you only have a short amount of motion that you can do. That's the short arc. If you're fully standing up and you bend over, that's a long arc pelvis on femur. 67% of the class got it and 33% missed it. So hopefully that makes sense. If we were lifting the knee up to the chest, that would be short arc femur on pelvis. And if we were standing and lifting the knee up to the chest, that would be long arc femur on pelvis. So hopefully that makes sense. Question 22 is another Trendelenburg gait. Which muscles are the culprits? Which ones are causing it? And we know that the hip abductors being weak can't control the pelvis in the frontal plane and cause the contralateral side to drop. And the gluteus medius and gluteus minimus are the hip abductors we're talking about. So hopefully that makes sense. 61% of the class got it and 39% missed it. So this was the mechanism of injury question for the knee ligaments, basically knee ligaments and meniscus. So in the question, someone's tackled from the right side, so they get a valgus producing force from the right side. So valgus producing force is more likely to injure the ACL, the medial collateral ligament, or the medial meniscus. It is much less likely to injure the lateral collateral ligament because ACL, MCL, and medial meniscus are all on stretch or on stress with this valgus producing force, whereas the lateral collateral ligament is not on stretch. So 61% of the class got it, 39% missed it. So this was the multiple drop downs. And the interesting one about this is that everybody got that gravity is the force and muscle is the resistance, and that the agonists are performing an eccentric contraction. But 56% of people chose the wrong agonist. So they said knee flexors, and the correct answer is knee extensors. So the knee extensors are performing an eccentric contraction to slow down gravity. So the knees are flexing indeed when you're going from standing to sitting, but what muscles are putting the brakes on that knee flexion? And it's the knee extensors. So definitely we are going to do more of these lever type questions in lab. They're going to be for upper extremity, but it's the same idea. So and we're going to do some closed chain upper extremity ones. So picture that. And the gravity's force, muscles, the resistance, and we know it's an eccentric contraction. Which major muscle group is performing the eccentric contraction? It's the one opposite to the movement that's happening if it's an eccentric contraction. So get that straight in your head. Guaranteed there's going to be one of these questions you might choose on the practical. So review those lever questions. Question 33, when active concentrically, the quadriceps extend the knee. That's just a statement. That's not the question. The question is, what kind of muscle contraction of the quadriceps stabilizes the knee during the weight acceptance phase of gait? And I think the fact that it mentioned gait sort of upset people because we haven't really talked about gait. But when what kind of muscle contraction do the quadriceps have to do to stabilize the knee when you have weight on the leg? They have to do an isometric contraction to keep the knee extended. So it's just the wording, I think, that messed people up. So my big advice for people is try not to overthink the wording. Try to think of it as like, what's it asking me? What's it asking me? How do the quadriceps stabilize the knee? They stabilize it isometrically. So 56% of the class got it, 44% missed it. So I think it's a hard question, but I think it's one you should know. Okay, 36. 33% of the class got it, but 67% missed it. So I'm throwing it out. And I think, again, the gait, the fact that it said gait messed people up. But I'm not asking you to analyze the gait cycle or know the gait cycle or anything like that. All I'm saying is, what won't the knee be able to do if the femoral nerve is injured? So the femoral nerve is responsible for the muscles that do hip flexion and knee extension. So quadriceps. So inability to flex the hip concentrically, you probably won't be able to do that. But does that affect your knee stability? No, it doesn't. Inability to flex the knee eccentrically? No, because we're well, anyway, I'm throwing this question out. It's I don't know. I might almost go with the inability to flex the knee eccentrically. Inability to extend the knee concentrically, yeah, it can't do that either. But its most significant deficit is inability to hold the knee in extension, so your knee will buckle when you try to stand. That's a hard question, and clearly I didn't explain it properly, so that's why I'm throwing that one out. So that one's due for rewrite. Let's rewrite it and come up with something better. Like all the answers could almost be right on that. So question 39, what type of joint is the transverse tarsal joint? Most of the intertarsal joints, all of the intertarsal joints are planar joints, as is the transverse tarsal joint. And 61% of the class got it and 39 missed it. It's definitely not a ball and socket, right? It's not a hinge and it's not a condyloid. So planar is the right answer. Question 41, which of the following structures actively support the medial longitudinal arch? If it's active support we're talking about, it has to be a muscle. Is the plantar fascia a muscle? No, it is not. Is the spring ligament and the deltoid ligament a muscle? No, they are not. Are the shapes of the tarsal bones a muscle? No, they are not. So the only possible answer it could be would be the tibialis posterior, and that is the correct answer. 44% of it got, 44% of the class got it, 56% missed it. So if we're asking which structures actively support anything, it's got to be muscles. Muscles are the sole active force in the body. That's going to come up again in the shoulder, so bear that in mind. So and then right into this, right into question 44, which muscle acts eccentrically at the foot to help control the rate of pronation? And it is the tibialis posterior. Remember, pronation is a combined movement of eversion, abduction, and dorsiflexion of any region of the ankle and foot. And so if you look at those muscles, the one that does the opposite, eccentric, is the tibialis posterior, and it's primarily slows down dorsiflexion, the dorsiflexion component of pronation. But your tibialis posterior is the correct answer for that one. 44% of the class got it, 56% missed it. Hard question. So overall, this was a pretty difficult exam. If you have questions about any other ones and you want to know what you missed, just shoot me an email. And if you passed, no matter what your score was, if it was 39 or above, you passed, 39 out of 53, then yay. And if you didn't, then we will be talking. So have a wonderful day. And next test, more pictures, and everybody's going to do better, right?